Introducing myself, my name is Abby Sachdeva, and I am the STEM Industry Outreach Specialist with the UCR Career Center. And very grateful to be here today with all of you and learn together. And I will be co-moderating the event with my colleague, Kristen, and I'm going to pass it on to Kristen.
Thank you, Abby, and welcome everyone. We're very excited to have you here today and to get to learn with you and share some insights. My name is Kristen Roberts. I am one of the career specialists on our student and college engagement team here at the UCR Career Center. I specifically support students in the social sciences, but we're excited to have you here. And I also wanted to give our partners over in the Health Professions Advising Center the opportunity to introduce themselves as well. So we'll start with Charlie.
Good morning, everybody. Thank you again for joining us. I'm Charlie Scruggs. I'm the director of the Health Professions Advising Center, and we're really excited that you are taking time to join us today to learn about health professions and our health.
Amber Nicholson. I'm the assistant director of the Health Professions Advising Center, and we're excited to kick off a full day of programming specific to pre-health experiences. And I'd like to pass it over to our third advisor, Stephanie.
Thank you, Amber. Hello, everyone. My name is Stephanie Vasau, and I'm HPAC's Graduate Assistant Advisor. I'm so happy to see you all here, and I hope you enjoy this expo and fair that we've prepared for you. I'll pass it back to Abby.
All right, thank you, everybody. So that was our core planning committee, everyone. So with that, I will let Kristen introduce our kickoff speaker.
Wonderful. Thank you so much. So we are so excited to welcome you all and welcome our kickoff speaker, Dr. Evita Rocha. She is a Latina Spanish-speaking, dually board-certified child, adolescent, and adult psychiatrist. She received her bachelor's degree from UC Riverside and her master's degree from UCLA, and her medical degree from the David Geffen School of Medicine at the University of California, Los Angeles. She values the importance of cross-collaboration, working towards strengthening and creating pipeline programs to increase diversity within higher education, the sciences, medicine, and ultimately psychiatry. Her ultimate goal is to decrease stigma around the utilization of mental health services and mental health diagnoses, specifically within underserved communities and the Latino community. We are so excited to have you, Dr. Rocha, and with that, I will pass it off to you.
So good morning, everyone. I'm so happy and honored to be here with everyone today. My hope is that we have a fun time, a good conversation, and hopefully I leave with you with a couple of different pearls. I was thinking about kind of with the time that we have today, what we can, what to talk about. And my hope is that this is the start of a conversation and continued conversations. And I wanted to kind of mention a couple different things. So I'm also on the board for the Chicana Latino Alumni Association for UC Riverside. So I always want to mention that because there is a huge network of individuals that want to help, that want to support you in this journey, that want to help you kind of make in terms of decisions or to kind of in terms of this whole process. So there's definitely lots and lots of resources. I know that the Alumni Association has kind of a mentorship program. So I would definitely recommend everyone to take a look in terms of the Chicano Latino Alumni Association and mentorship opportunities through there, through the Alumni Association, and just getting a wealth of experiences. I'm from the Inland Empire. So I kind of went to school for high school and elementary school here locally. So I'm very invested in the community, and I'm very honored to be back. And I have a strong sense of investment in the community. So I also sit on a board for Reach Out, who does fantastic work. If you're interested in any sort of community work, want to learn about the nonprofit world, I would definitely recommend that you look into Reach Out, as they kind of do mental health work. They work with students, they have pipeline programs, and they do a lot of great work in the community. And hopefully what my hope is I'm talking really fast because I know that I only have a short amount of time and I'm trying to cram a lot in a short amount of time. But my hope is that a message of hope, a message of si se puede, si se pudo. And what that means is that it can be done, it will be done. And I think that every single day we hear, whether it be our own voice or other individuals, lots of that. I can't do this. This can't be done. And a lot of negative self-talk. And so I think that it's very, very important to kind of continue to foster and be a message of, yes, it can be done. And to get to that message, I would say that we really, really need to foster kind of self-care and resilience. And to do that, I would say kind of making sure that you are exercising, sleeping. Those are so important. People laugh and say, what, exercise, sleep? And we know that it's actually better in terms of learning and studying, retention of information if you are exercising, if you are sleeping. So sleeping is important to kind of process and make sure that that memory stays so that you can remember it on the final, remember it on that when it comes up again in the next class. So again, that those self-care points are highly important. And again, if you are taking care of yourself, it's easier to stay motivated. It is easier to kind of, when a big challenge happens, to be able to say, okay, dusting myself off and I'm ready to go again. And I will share with everybody that, again, I'm no different than anybody else. I've had lots of different challenges, lots of different kind of things didn't go the way as I planned. But ultimately, when I've looked back on those sorts of things, I'm like, this is even better. And we'll talk about that in a little bit. So don't worry, I'm not leaving you hanging. We're gonna talk about that in a little bit and what I mean by that. And again, a big part of my success in my journey has been mentors, and mentors of all different individuals, whether it be an individual that was kind of a year above me. And one of my favorite mentors, I was in the honors program and I was doing the summer program before I started college. And there was this awesome individual. She's now a family medicine doctor, Dr. Tiffany Hill, and she was running around all day long with a crown on her head. And the entire day, I kind of was like, okay. And then at the end of the day, I decided to ask her, why was she wearing that crown on her head? And so for her, she said that it was really important to model the behavior that you are kind of something valuable, you are very important, you are someone to be respected. And that she was hoping to impart that message on all the students that she was working with that day so that they kind of took that with them throughout kind of their college experience. And so, and I found that very powerful. And she also directed me to some really awesome research programs. So again, I always want to, again, emphasize mentorship, but also mentorship, and there's lots of different forms to it, whether it be a student, whether it be someone that is kind of in advising that helps direct you in terms of programs and different options that are out there. I have, so Diana Fox, who's the executive director of Reach Out, she's been a longtime mentor. She's not in medicine, but she's definitely a phenomenal leader. She has made a huge impact in the community. And so I've definitely learned a lot in terms of leadership, how to run kind of meetings or how to do things effectively, communication. And so I think that overall, I always emphasize, because a lot of times we focus, it has to be this person and it has to be kind of this person doing this thing. And I always want to share that mentorship kind of can happen in so many different ways, and so many different individuals have a lot to teach us. And I'm still on that journey of learning and growing and being a better version of myself today. And that's my hope forever, to kind of be a better version of myself every day. So in that, I want to say that, so I promised that I would go back to what I meant in terms of challenges. So I will say, when I started off kind of in your shoes, the only thing that I had been introduced to was family medicine. And so I wanted to be a family medicine doctor for a lot of different reasons. One of which is that kind of my experiences with my family was the disconnect between physicians and patients, and language being a barrier, being one of the barriers, sometimes being kind of cultural differences and lack of communication and effective communication. So I grew up with lots of stories with my family saying, pues ese doctor no sabe, that doctor doesn't know anything, or ese doctor me dijo hacer esto, and that doctor told me to do this. And ultimately it was demonstrating kind of a disconnect and not an effective kind of patient encounter. And my goal was to make that better, to make that effective, to make sure that my family member's diabetes was being managed, and that was an effective doctor-patient interaction. And especially in terms of language, that there was an appropriate use of interpreters, and most importantly, my grandmother on my dad's side was a curandera. And so I have a high respect in terms of alternative medicines and healing. And so ultimately also kind of respecting that and understanding and saying, okay, well, what other methods of healing are we using? And also because that can impact medicine in kind of the clinical setting. And so leaving that door open to kind of get a better understanding of family dynamics and what's going on, which is really, really useful in child and adolescent psychiatry. So again, my whole goal was to be a family medicine doctor. And then I got to medical school and I was like, I like everything. I don't know what I want to do. Ultimately, I matched into family medicine, but then decided my heart was in psychiatry and mental health, in the mental health field. And so I changed pathways and ended up kind of doing residency at UCI for psychiatry. And then I promised myself, nope, I'm going to finish off with psychiatry, not doing any sort of fellowship training. And then realized I had a heart and passion for child and adolescent psychiatry. It was pushing at my heartstrings. I had to follow it, couldn't not listen to that kind of that calling. And I really enjoy and love child and adolescent psychiatry. And if you would have asked me in that first year of psychiatry residency, Evita, do you ever think you'll do a fellowship or do child and adolescent psychiatry? I would have sworn to you, no, that's never going to happen. I can promise you, and that's a bet I'm going to win, that I am not going to do that. And here I am as a child and adolescent psychiatrist back in the Inland Empire and definitely enjoying the work that I do. So ultimately, what I want to share with you is make mistakes, get messy, like Miss Frizzle. I absolutely love Magic School Bus and Miss Frizzle. So life is kind of, it's a journey. It's a beautiful journey. And so we can definitely be more resilient if we take care of ourselves and in the basic things, the sleep, the exercise, the meaningful time with other individuals that we care about. And challenges will happen. So I'll be very, very honest with you that challenges will happen. And I'm sure that in terms of the individuals that are listening today, and whether it be kind of at another time, that each of you have a beautiful and unique story. And we definitely need each and every one of you in the health professions. And my greedy hope is that you come and join us in psychiatry and you come and join us in child and adolescent psychiatry, because we definitely need more of you. But I think overall that you stay resilient, because we definitely need each of you. I think that that was everything that I had in terms of my short list of what I wanted to rush through today. And again, my hope is that this was just a brief introduction to this wonderful program that you'll be doing today, and to share that message of si se puede, si se pudo. You guys have all already overcome many challenges. And you're here and you're motivated and you're in this conference. So definitely we want to have you join us in the health professions. And so I'll stop there to see if there's any kind of questions or anything that anybody that I touched on briefly that anyone had any questions about. If not, I'm really good at keeping talking. I inherited that from my dad.
Thank you so much, Dr. Rocha. That was incredible, and so many great advices in such a small talk. Thank you for that. We do have a couple of questions in the chat, so maybe we can address those. And if more questions come up, we can get to those, or you can keep talking, because it's been a delightful experience listening to you. So the first question in the chat is, what advice would you give to first generation students interested in the medical field?
Right. So that's a very good question. So across the board, I was always the student that was kind of looking at what the other students were doing and then kind of saying, National Honor Society, okay, I think I need to sign up for that, and I'll do that too. So I didn't have a roadmap. I didn't even know, like in terms of majors, how to pick a major. I said, I like biology, I like chemistry, let's combine them. I had no idea what biochemistry was. And I didn't even know you had to pick a major. So when that was an option, I was like, okay, what's going on here? All right, that sounds interesting. And so I would say, and that's the power of mentorship, in that you have individuals that are helping you in terms of, this is the way to go, this is the direction that would be probably recommended, and to help with that roadmap. So that, because I definitely made mistakes, and so that you don't make those same mistakes, and to kind of figure out. So I would say that that's why mentorship is so important. And there's so many different ways. There's mimentor.org. So I would definitely look into that. Just type in Google. They have all kind of in terms of the social media. There's NHMA, the UCR Alumni Association. So there's lots of individuals that are happy and want to help. So I would recommend and again highlight the importance of mentorship. And then I saw the question in terms of debt, and I really want to, that's a really important question. So I grew up kind of humbly, and I'm very proud of that. And in that, I've done this for a long time in terms of working with students. This is something I love and enjoy doing. So with that being said, I want you, and one of the things that my mom always taught me was that your education is an investment in yourself. No one can take away that investment. They can take away your car, they can take away kind of physical possessions, but the information in your head, that investment that you've made in yourself, no one can take that away from you. That being said, if you look at the numbers, sometimes it can feel overwhelming, like, oh my goodness, I'm never going to, that's a lot of money. But I will also point you in the direction that there's lots of scholarships. There's lots of programs that the Chicano Latino Alumni Association has a scholarship. There's so many different scholarships out there to fund your education, whether it be kind of locally on campus, whether it be kind of through different organizations. So I would say look at into kind of all the different funding sources. Your grades and education are also a funding source. So I would always kind of recommend students to kind of make sure that those academics and grades are number one. And because I know we can get very focused on all these different kind of clubs and projects. So definite grades number one, and then of course experiences are important too. And also there's, if you work in primary care, if you work in psychiatry, there's a lot of loan forgiveness programs, National Health Service Corps, and working in an underserved area, California, based on kind of the patient demographic that you work with. They also have loan forgiveness. So again, I never want finances and money to be a deterrent from following your dreams, following something that you're passionate about, because ultimately my goal for each and every one of you is to say, this is a job that I love. This is something that I enjoy doing, and no job is perfect. There are, so to no matter what job that's out there, there are always kind of negative and positive aspects. But overall, I can promise to you that I love my job. I enjoy doing what I'm doing. It is very important. It is meaningful. I feel like I make a big impact in terms of my families and patients that I work with. And so again, I want that for each of you, that you find that career that you love doing. And I've had interactions, unfortunately, with people that I went to high school with, and they wish they would have invested in themselves. And I never want that for anybody. I want each of you guys to say, I've invested in myself, and I've invested in my education and my future, and I really enjoy what I'm doing. So let's see.
Thank you. I would like to follow up on, positive self-talk and self-care that you spoke about. Could you elaborate for us how students who have so many things going on at the same time and are kind of struggling through difficult schedules and classes and research work, and how do you have any tips to share in terms of how they can prioritize self-care just to keep their productivity and keep going?
Right. So I feel like that should always be number one in terms of self-care. And because I feel like you are not able to study, you are not able to function if you're not taking care of yourself. So stop and take breaks to eat. Stop and take breaks to go to the bathroom. I feel like there's been this whole culture in just academically medicine that I haven't gone to the bathroom in 5 hours, go me. I haven't gone to the bathroom in like 10 hours, go me. And really, that isn't something to be proud of, that you haven't like eaten in that long, that you're not taking care of yourself. And so I would say that, and it's a journey, because to this day, I'm depending on what's going on, I have to work on that. I have to say, time out, I'm not doing so good. What do I need to do? What am I missing? And so I would say it's important. And it doesn't have to take a lot of time, because sometimes we feel like, oh, I've got so many different things going on that I can't take 1 minute out. And I would say mindfulness can even take 30 seconds, 10 seconds to even take some slow, deep breaths. So it doesn't take a lot. But it is a constant reminder. I need to take 1 minute out of the whole day to take some slow, deep breaths. I need to take 1 minute out of the day to do an inventory and say, wow, this headache that I have, like, oh, I haven't drinking any water. I haven't eaten in like several hours. My muscle is like super, like I can feel the tension in my shoulders. And that's also a very helpful exercise to kind of see where you are, because I feel like sometimes we're so disconnected with our bodies and how we're actually doing, that just that exercise of mindfulness, of being just kind of present and just doing just a 10-second inventory of how am I doing right now is really helpful. I think one thing that has been helpful across time has been gratitude exercises. So I will frequently check in with myself and say, well, what am I grateful for today? What is going well for me today? Because a lot of times we, in terms of the way that we're wired, we focus on, well, what's going wrong, the things that aren't going well. But there's a lot of, it can be really, really helpful to focus on, well, actually, a lot of things are actually going really well, and focusing on that positive, but also sharing that positive with other individuals. Because I feel like we're very good about telling others when things aren't going well, but we're not very good at telling others, like, you did a really good job. Thank you for helping me with this topic, or thank you for just being present with me today. And so if giving that feedback, and so that's also a gratitude exercise, because you're showing gratitude towards others, and it's a really positive encounter. And so I would say that start small, but I would definitely recommend that it's important to do it every day, and start small. Say like 1 minute, I've got my water jug, and that's something that I'm working on, to drink more water, because I'm very good at the coffee, not so good at the water. So, but I make it a point. I have plants, and that's one of the things that I've learned over time, that is something that I'm seeing something grow. I'm working and invested on these plants, and it's very soothing, and it's with nature, and it's outdoors. And so I would say that it's very, very important. And if you are so busy that you can't take out 2 minutes for yourselves, then it may be time to reevaluate with a mentor. Do I have too many things going on? Is there something that I need to take out? Because we need to be very mindful of ourselves and our mental health now more than ever. And so I would say that may be time to do an inventory and say, is there something that needs to be eliminated maybe right now, and I can pick up at a later time? Because we definitely need that balance of ni muy muy ni tan tan, like not a lot, not a little, but make sure that we're doing okay on that seesaw. And so let's see, how did I handle setbacks or negativity? So I would say that, and that was one of the things that I forgot to mention. So I would recommend either a shoebox. What I had was kind of Pinterest and kind of all these different social different things. So I used to have a shoebox with different things that I found inspiring, whether it be like a news clipping or somebody who really like a quote. And so I would put it in this box. Later on, it evolved to Pinterest. And so when I found like a really great quote by like Amelia Earhart, or kind of any Sonia Sotomayor, individuals that I really admired, and I found a really beautiful quote, Michelle Obama, then I would kind of put it on that board. I would say that that's a multi-step process, because it's important to have that board and things that motivate you. But also in terms, when you're not doing well, being able to know who are the people I'm going to reach out to that are going to help pick me up when I'm not doing well, or can recognize that I'm not doing well. And so across time, I've had multiple really wonderful friends that I've been able to count down if I had kind of a disappointment, like a test didn't go that well, or I didn't end up kind of getting an internship or something that I wanted and I was really hoping for, and then they directed me, well, why don't you take a look at this? And it turned out to be better. So that I would say that that there's going to be setbacks, but I would say that across time, I've always seen them as an experience to learn, and it has just been an overall kind of a positive experience, and I've learned a lot through it. And I would say that again, sometimes we hear these speakers and we feel like nothing bad has ever happened. I think in fellowship, my dad was in the ICU for several months, and so I almost thought I wasn't going to finish fellowship. Thankfully, I did, and I had an awesome program director that helped me write about it and write about that experience, and process it with me, and was there to make sure that I finished fellowship. But I was also there for my dad, and when he was going through that whole process. So again, I will say that So having those different boards that remind you kind of on a daily basis, whether it be kind of, you see a bulletin board with all the different things that motivate you, that shoebox that you can go through on your phone, like the different social media to remind you of quotes and things that you like, and also that network of people that you care about, mentors that are invested in you to help you, or whether it be kind of figuring out a problem and figuring out, okay, well, what's the solution with you? That's what I would recommend. In terms of the shadowing, so there's a couple different ways. I will say that I've done a lot of work with NAMI, so the National Alliance of Mental Illness. They do a lot of really wonderful work in the community. A lot of nonprofits like Reach Out do a lot of really important and valuable work in terms of the mental health field. So I would direct you to either Reach Out as a nonprofit or NAMI in terms of getting more experience. I'm not sure in terms of what experiences are in terms of the Riverside University health systems. Would be something to consider too. So those would all be kind of ways to get more experience. I would say that NAMI is really, I've learned a lot. I used to run, so I started off with English family support groups, and then I changed over to Spanish family support groups. I learned so much from my families. And so in terms of the support they offered each other, how to navigate, how to help their loved one with kind of a mental health diagnosis. So there's a lot of power and information that can be learned. And even as a resident, I learned so much from my families. So I would say that would be a good place to go. And then the last one is a really nice one. So I'm married. I met my husband at UCR, and so he graduated in computer engineering from UCR. So we're both proud Highlanders. We have 3 kiddos. So our daughter is going to be turning 9. She's 8 right now. We have a son who's going to be turning 7. He's 6. And then our littlest one just turned 4. So I do have 3 kiddos. And then I did meet my husband. We were planning a conference for so it's a youth conference through Chicano student programs. And so I was pre-COVID, I had been involved in that conference for 12 years because it meant so much to me. And I met my husband kind of planning that conference because we both are very interested in higher education and diversity within the sciences. And we actually used to collaborate in terms of providing a workshop around science. And so I would say that it's always a balance, right? Whether it be kind of academics, whether it be health and wellness, but you are able to navigate that balance better when you are doing well. And I think that I always draw that example of that gas mask, and especially being a parent, that you got to put your gas mask on first before you can help other people. And so, and I really, really think that that's an important kind of image, that you have to invest in yourself. You have to take care of yourself so that you can be resilient. You can do all the wonderful things that you want to do in the community, in the world. So again, that self-care is so important.
Thank you very much, Dr. Rocha. That was incredible. And we are so excited and happy that, we had the opportunity to hear you and your thoughts and your journey and your advice. And thank you so much for your time today. And if you have any final words to share with our students.
Right. So overall, I'm very honored to be with each and every one of you this morning. I think now more than ever, signing on to any sort of Zoom conference is just huge 2 stars for everyone who did that today. And then overall, just my hope is that, again, mentorship, the importance, there's so many wonderful individuals that want to be part of your journey, that want to see you succeed. So check out the UCR Alumni Association, NHMA, MSP. They have lots of, at this point, I was part of Medical Scholars Program, and lots of wonderful individuals that have now graduated and are doing really wonderful things in the community. And ultimately, if I finish on one phrase, si se puede, si se pudo. It can be done, it will be done. And my hope is to see you all as future colleagues in the future. So have a wonderful day, okay?
Thank you. Thank you so much. All right, with that, we will head to the next part of our program today. So we'll be getting into lightning talks now. Some of you might be familiar with lightning talks. So we will have two different speakers. Each of them will be talking on specific professional development topics for 5 to 7 minutes, and then we will have 5 to 7 minutes for you all to ask your questions. So as they're talking, if questions come to mind, please feel free to start adding them to the chat and we will be addressing them after. And we will also have the option for you to unmute yourself and ask your question if you prefer that. But we have limited time, so if you have questions, start thinking of them as our speakers are talking. And with that, I'd love to introduce our first Lightning Talk speaker, Jam Harley, who is the Interim Pipeline and Outreach Manager at David Geffen School of Medicine at UCLA. And Jam will be talking about what makes their school and program unique as a community and support system.
Thank you so much, Abby. And hi, everybody. My name is Jam Harley. Again, I'm the outreach and I'm the director for all the pre-health programs at the David Geffen School of Medicine at UCLA. So I just want to really highlight, we have 4 different MD programs. I know not everybody are probably aware of that. So there's several tracks that you can do at UCLA, and a lot of them are based on your interests and your goals as a physician in the future. And so we have 2 MD programs and 2 dual degree programs where you can obtain an MD with a master's or an MD with a PhD. Our MD with a PhD program is full ride all the way, and everybody that is in that program are scholars 100%, including living expenses. When it comes to support that we offer, we have learning skills specialists that meets with their student regularly. We have over 60 student orgs that's run by students, including some faculties as mentors for all these student orgs. So that's a lot given your class of 180. But you have 60 to choose from. And then other than that, our students are extremely active in the community, and there's so many ongoing projects and research that our current med students are participating in partnership with our community leaders and our own faculties at UCLA. And lastly, I want to highlight, we have partnered with over 10 different hospitals and clinics all over LA County and even in different counties in Southern California. And so many of our students are rotating in both private and public sector settings type of hospitals and clinics. So that's definitely one way to get good amount of experience as a medical student and get an earlier grasp when it comes to the different communities and different healthcare system that you might be interested in serving as a physician in the future. But that's all I have for UCLA.
Thank you so much, Jam. And are there any questions that any students have about UCLA or about how they support their community?
Jam, I would like to ask, are there specific academic and career counseling opportunities for students within your school?
Yeah, are you talking about pre-meds or?
Yes.
Yeah, so that's gonna come back to me. So that's gonna be with me in my office. So I am the main pre-health or pre-med advisor for UCLA and especially at DGSOM. We have 3 summer programs, and that's an opportunity for all pre-health students because that's not just for pre-med. So we have SHPEP, which is ran with WAMC. We have UCLA Prep and UCLA RAP. RAP is our post-bac program, which are for reapplicants only and California residents only, but SHPEP is for first and second year students. Prep is for juniors and above. It's kind of how you quickly do the math there, but SHPP is for dentistry, nursing, and medicine. We accept 80 students in total. Prep is for pre-meds, and that is for about 30 students, and RAP, we accept 10. Prep and RAP, we do an extensive MCAT prep course during the summer. And overall, in pre-COVID days, all of them have opportunity to, to shadow physicians, to have all those interprofessional conversations and networking opportunities with our faculties as well. And this year is our first year we're actually launching an initiative where we have long-term mentorship programs for all our summer students. And that means that you're going to be paired up probably in a 1-to-1 ratio with a faculty that volunteer their time for the next 2 to 3 years. Basically, they're going to be there with you, checking up on you every single quarter until you're ready to apply to medical school or other health professions. So that's our first initiative this year. The second one that I just want to quickly plug into is we had an alumni forum, our pipeline programs, and they graciously donated money that will be allocated towards our prep students who are applying to medical school. So they have an opportunity to apply for this scholarship to receive some financial help during the application process, because all of our students are disadvantaged students. And usually the hardest time comes again when they are applying to med school, of being able to afford secondaries, interviews, and all that. So we have that fund, and that will be available at least in the next 5 years.
Awesome. Thank you so much for sharing that. I know the cost is definitely a huge factor in considering how many schools students can apply to. We had a great question come into the chat about, as students are applying and the applications are being reviewed for the interview phase, what important qualities are you looking for in an applicant that will really determine if they get the interview?
This is for medical school, right? So so when it comes to all our programs, at least at DGSOM, it's don't underestimate your experiences and your life story. And I feel like at that point, that's really your strongest suit, is your story, your goals, and how, if you fit our mission, and if we fit yours, right? And so at that point, it's all about finding a match of being able to be the school that could support your goals, but at the same time, for you to be in a school, right, that will support your goals. And at that point of the interview process, it's really getting to know you and your goals of what kind of physician, where do you want to serve? Is that the same physician that we envision, curating or at least training in our facilities? So it's weird, but the answer, it's really your life story, and it's you're basically your strongest asset at that point when it comes to the process, and not anything else. It's just you. It's really you.
I love that. Thank you. Very similar to our kickoff speaker, kind of recognizing the value that we all bring. Had another question. Now we're kind of moving into the interview phase, but any suggestions on how to practice MMIs as well?
Practice what?
MMIs.
So MMI, for my personal opinion, it's a little, you can't memorize questions and answers for MMIs because you never know what the questions will be. You don't know who your interviewer, you don't know the situation, right? And that's the whole point of MMI, is to really test you of all these things. Don't panic. Don't be, don't stress out if you don't know the answer, right? And so the best way to prepare for it is just to remember the values that you have, and really put yourself and submerge yourself into the question of what would you do. And another thing is, it's not mainly preparing for it. It's really being present at the moment. And take your time. I know it's going to be a quick 2 minute to read the prompt, but really look for what they're looking for. Like, what is this question? Is this a legal question? Is this an ethic question? Is this, and then try to put yourself out there whenever you have an opportunity to bring a personal story that you might have encountered. Don't be shy and plug that in. But if you don't, then obviously don't force yourself, to just every single time, oh, well, I had this and that, like, you don't have to do that all the time for MMIs. Just do your best, answer the question as much as you can, and as best as you can, and then really pay attention to the question. Sometimes they will ask,
how will you decide, not what would you decide, or, you know, how will you choose, not who will you choose. So pay attention to those little clues in the questions, because those could matter a lot. And don't be afraid to also ask them, you know, clarification. If you're really unsure what the question is, ask them to clarify, or tell them, this is how I interpreted the question. Can you confirm if this is what the prompt is asking? And then answer, right? So it's not much preparing for it. Well, I will add one thing. You can prepare for those legal type of questions, especially if it's not in your state. Especially if you're interviewing to a different place that's not your state, and you know, and you just want to be more prepared, then you can do that. Then maybe you can do quick study about their laws and regulations, especially, you know, what are their rules when it comes to their minors, blood donors, you know, those very common situations that could come up. Those, and it might be different, you know, abortion law, age, when it comes to people with disability, like what are the age consent and all that stuff, right? Like those you might be able to look up, but other than that, you also are not expected to know that. But just try to do your best, answer the question, and you know, be confident with your answer. Don't argue with your interviewer.
This great advice. Thank you so much for sharing all of that. I do want to be recognizing our time, so we'll be transitioning to our next lightning talk. But Jam, please, there are a couple questions in the chat about some eligibility for some of the programs, so I would invite you to respond to those in the chat if you are able. But with that, we will transition to our second lightning talk of this morning. And so I'd like to introduce Marc Salvatus, who is a PharmD and an assistant professor of pharmacy practice at West Coast University. And Marc will be sharing how their school has adjusted to the virtual environment.
Thank you, Kristen, and thank you, Abby, and your team for organizing this whole event. I think it's a really great opportunity for students to learn about the different health professions out there. So speaking from a pharmacy perspective, like Kristen introduced, I'm an assistant professor of pharmacy practice over at West Coast University School of Pharmacy. Quick little info about our school. We're a 4-year program. We are located in the heart of Los Angeles, California. And so there's definitely a lot of opportunity to be involved with the community and serving underserved populations. So regarding the question about virtual instruction in the virtual environment, I mean, it's been quite a year for pharmacy schools in general, and in all schools in general. And as far as adjusting to the virtual environment, especially for a doctorate level program like the PharmD program, there are 3 main areas that I wanted to touch upon that I feel that we've made our transition to the virtual environment as seamless as possible. First, I do want to talk about the remote learning, right? That is the core aspect of education. And so we do have several programs that allow us to further interact with students in a remote environment. One of them is Blackboard Collaborate. So all students do have access to our lecture recordings through Blackboard Collaborate. That's where we upload all of our lecture materials, handouts, guidelines, and things like that in order for students to get better prepared, you know, for the curriculum. We also have Panopto, which is one of the programs that we use to create engaging content for our students, and vice versa, right? So we do have activities where we're able to reach out to students and develop videos for them, and they're able to upload their own videos regarding feedback they received on assignments, other assignments and projects like that. We have several faculty development seminars where we're able to educate, where the faculty ourselves are educated on best practices for things like video and audio recording, production, and things like that. So we are best equipped to create engaging content for students. We are transitioning to Canvas, which will be our new learning platform online. So it's kind of like Blackboard Collaborate, but there are some enhanced functionalities of that. We have Zoom, pro Zoom accounts, so that I'm always a fan of, you know, having a pro Zoom account, so we're able to, you know, make lectures as without that time limit that non-pro Zoom accounts have. So we do have those several technologies available that allow us to still create that sort of virtual environment to make it as similar as possible to what students have on campus. We have commitment to interprofessional experiences. We have partnerships with our nursing, occupational therapy, and physical therapy programs, as well as medical schools locally within the LA area. And with telehealth becoming more important than ever, we like to immerse our students in that experience by having them perform things like remote medication counseling with simulated patients in our skills lab courses. Another aspect of the whole remote communication with other healthcare providers includes pharmacists communicating with physicians. There are times where pharmacists are able to reach out to physicians on either the hospital setting, in the community or retail setting, to say, hey, you know, what do you think about adding this medication to a patient, changing the dose, etc. And we also immerse our students in that experience as well by simulating by faculty simulating physicians, right? So having students practice their communication skills with other healthcare providers in that remote setting is something that is still well within our curriculum, and it's not lost in that virtual transition. Another aspect of that virtual transition is hands-on learning. So as pharmacists and as pharmacy interns and pharmacy students, we are on the front lines of the healthcare efforts to, for example, vaccinate the public with the COVID vaccination. So we do have training sessions on campus where we are training students to be able to deliver vaccinations and administer them confidently and in the most sterile, appropriate manner possible. So we've been having these small groups come onto campus of students, you know, following social distancing guidelines and things like that, to be able to train them to be capable to administer these vaccinations and other techniques as well, such as sterile and non-sterile compounding, so that they are able to really bring these skills into the practice setting. And then finally, just wanted to touch upon engagement, right? So when students are not on campus, you know, we do have students who, you know, do prefer that environment where they're surrounded by other students to kind of help that collegiate atmosphere. So we do have the Remind app where we are able to reach out to students either in a group setting or, you know, individually, and tell them, hey, you know, there's a new announcement that's been posted on Blackboard. You know, there's a new assignment that I would like to have you guys take a look at. These new guidelines have been updated. Things like that to help keep the engagement between faculty and students. Me, myself, I like to have office hours through another application called Calendly. So students are free to set up an appointment with me and as well as other faculty while we give them our availability. So I really encourage students to reach out to each other, to create study groups, to reach out to faculty, whatever they can, and doing my part in terms of making myself as accessible as possible to students. So overall, you know, the transition to remote learning has brought some challenges, but also its own opportunities for the PharmD program in particular. And it really allows for creativity in helping us deliver content to students and think of novel ways to deliver instruction and engagement to them as well. So thank you.
Thank you so much, Dr. Salvatus. I did want to open it up for questions. If someone would like to ask I see one question in the chat. What made you choose pharmacy over other healthcare careers?
Yeah, that's a great question, Lisa. And I think you know, it's a very good question, because there are a lot of different healthcare professions, as you've seen, but pharmacy in particular, I think, has a specific niche within the healthcare field. You know, for my personal story, the reason why I chose pharmacy over other healthcare profession was, as an undergrad at UC Irvine, I was doing research, right? So I was doing research in a lab that involved, you know, stem cell research. And for a time, it was something that I felt like maybe something I could be involved with as a career long term. But something happened with one of my close relatives, someone who's very dear and close to my heart. And you know, it was involving their medications and their health, right? So I felt that if I knew a little bit more about their medications, what they were taking, why they were taking it, if there were any drug interactions, maybe I would have been able to help them a little bit more manage their health. And so that's kind of what changed my mindset to something that was more on the front lines of the healthcare field. So pharmacists are really one of the most accessible members of the healthcare field. I mean, you can go to your local CVS or Walgreens and talk to a pharmacist there, and they're happy to help. And so I wanted to be involved more with that aspect. So I think, you know, is what really set the road for me in terms of thinking about pharmacy as a career. And even as a student going through the PharmD curriculum, I learned so much about pharmacy that isn't really explicitly stated, in a typical, job description of a pharmacist, right? There's a lot of involvement where pharmacists are taking a look at patients' medication lists and seeing areas where it can be optimized. And so we are reaching out to different healthcare professionals to kind of make those recommendations. We are reaching out to the patients to say, hey, I noticed you were on this medication. Just wanted to check up on you, how you were doing with it. Are there any side effects that you are kind of concerned about? Maybe there are other ways that we can help manage those side effects. So a lot of different aspects in a patient's medication therapy allow pharmacists to be able to increase the quality of care for our patients.
Thank you. So for students who are entirely remote at this time, with limited in-person experiences, whether it's clinical or research, where options have kind of limited to the in-person access that they had pre-COVID, what would you suggest as some creative options that they can leverage to get that experience?
Yeah, so number one thing that I would recommend is getting that pharmacy experience firsthand. Being exposed to a pharmacy environment, working in a pharmacy, whether that is in the retail setting, hospital setting, long-term care setting. There are a variety of settings where pharmacists and pharmacy interns can work, and pharmacy technicians as well. So getting that experience, possibly getting a pharmacy technician license. When you do enter the pharmacy curriculum, you immediately work on getting that pharmacy intern license. So that allows you to get a bit more leeway as far as what you can do in a pharmacy, as long as you are under the preceptorship of a pharmacist. So getting that experience, being exposed to the types of medications that you may see in a pharmacy, those common medications, really helps bridge that gap between the classroom and the actual practice setting where pharmacists work. So getting pharmacy experience, whether that's through a technician license, whether that's through volunteering at a pharmacy, becoming a clerk even is an option at some of our independent pharmacies. Those are all ways that I would definitely encourage to get that sort of experience, to better give yourself a perspective as far as what is pharmacy and what could I potentially be contributing when I enter that field. But for West Coast University in particular, we do not require our students to, or our potential students to, have pharmacy experience. But they do need to have that sort of drive, that motivation for lifelong learning, that positive attitude, those communication skills that are so necessary for a pharmacist in this time.
Thank you. There's another question in the chat. What are some of the biggest issues that PharmDs are experiencing in their career?
Okay, so thank you for your question, Charles. So issues. So I think it's more so of a conception of that the career is becoming a little bit saturated, especially in California, and that is because there are pharmacy schools opening up around the areas, and there's this misconception that once students get their PharmD degree, how are they going to find jobs? But the thing with pharmacy is that it is an ever-evolving profession. Pharmacists are being involved in more settings, more different settings of pharmacy than just, I guess the most common ones being community setting or retail setting, and then in the hospital setting. Pharmacists are getting more, practice experience, specializing in different fields, infectious disease, health information technology, and other fields like that. And so with the expansion of the role of the pharmacist in the community setting, I think that the pros outweigh the cons as far as looking for career opportunities. You're seeing now that pharmacists are more and more on the front lines, delivering the COVID vaccination, administering them to our patients. And so more help is needed in that area. So there are a variety of other settings where pharmacists can practice. And I would definitely encourage students who do enter the program to look into these fields and be front runners for those specific settings.
Thank you so much, Dr. Salvatus. That was really good advice. And we're very grateful to have you here today. And thank you so much for sharing your experience and advice with our students. I invite you to stay a little longer. And if you have any other questions, please add them to the chat. But thank you so much for being here. And with that, we are at noon. So we will be transitioning to the next portion of our event, which is